Timing is everything when it comes to diagnosing and treating a heart attack.
Yeah, meaning do it quick. Now a doctor at the Medical Biotechnology Institute says they found a way to give some life-saving minutes back to patients. 11 News reporter Melissa Carlson has that story.
Seconds can be the difference between life and death for someone suffering from a heart attack.
The earliest diagnosis of a heart attack would clearly be beneficial.
There are a number of different ways to test for a heart attack, but testing the blood for certain proteins released after a heart attack gives doctors the concrete information they need. A machine like this takes 20 minutes to give results, but Dr. Geddes at the University of Maryland Biotechnology Institute says he can do better.
We can detect proteins in blood and serum that cause or are effective after a heart attack within 20 seconds.
Geddes explains that the technology called microwave accelerated metal enhanced fluorescence works by detecting the most minute amount of the protein and says it's extremely sensitive and rapid thanks to nanotechnology, a simple slide, and a microwave. And Dr. Geddes is working on making this test portable. That way you can determine if you've had a heart attack before you even get to the hospital.
We envisage that this technology could be miniaturized into small, compact devices, very similar to the size of a pregnancy test or very similar to the size of a diabetes finger pricking type stick.
Critical time can be saved by the early diagnosis and then, of course, implementation of early therapy.
Dr. Geddes' findings have been published and the patent is pending. In Baltimore, Melissa Carlson, WBAL TV 11 News.
Very interesting. And Dr. Geddes says in the very near future, we could actually see a test like this being used to determine if someone has been exposed to a DNA-based virus like the bird flu or anthrax. And you can determine your heart risk with our online test. Log on to the WBALchannel.com, click on Health Alert.